Great. Well, welcome to kind of my first podcast, reaction podcast, big podcast. I'm not even sure what we're going to call it, but I've been asked to do it for a long time. I think it's because people want to get me in trouble because I back myself into a corner a lot. And as I thought about like who could I interview first, and I get pinged about AI all the time. Like it just comes at me in droves, whether I want to or not. Everyone's asking my opinion. And I said, well, every time you ask a free opinion, you get what you pay for. But I said, enough's enough. I'm going to do it. And Elad, who is the founder and head CEO of Aidoc, one of the companies that gets more pub than anybody else, and probably deservedly so, he agreed to kind of step into the fire. So welcome.
Well, I'm excited to be in this first version. We're doing history together.
Yeah, this could be one of those days that truly lives in infamy.
Everybody's going with it.
Yeah, exactly. You suckers. So, why don't we talk a little about your backstory? Where are you from? A little bit about your career, super quick. Don't bore a bunch of people. But then specifically, why you started the company.
Yeah. So hopefully it's not too boring, but my background is not from healthcare, but from AI. I headed AI for Israeli Air Force. Been in
That's pretty cool.
Yes, it has. I will say the thing that I've learned the most, I'll give you the experience of my typical week. I got in the morning with a lot with academia, worked a lot with them. And then every like Sunday, beginning of the week in Israel, had like another professor coming in like, we should do this and this like algorithm. And I'm like, I mean, guys, it's awesome, right? That we have all these new ideas, but let's focus on making an impact. And I think that kind of intuition that really AI is not about developing the coolest algorithm, but actually driving, operational effectiveness. I think it's what drives a lot of the thesis we have here in Aidoc.
Gotcha.
Yeah, and then I mean that I finished my service and flipped to the opposite side of the world, which is healthcare startups. And startups in general, big organization, small organization. And I will say that we always knew from the early days in Aidoc, the big thesis was that you have all these AI point solutions and they're amazing and they're valuable. And I'm not saying anything bad about them, but it's not a scalable consumption model for a health system, right? Like you and I, we can't, buy 1,000 different TV shows and we're like, signing up for a streaming service, right?
Yeah.
I think that was kind of our thinking, and the whole story of Aidoc is really the story of building the enterprise AI platform.
So it was never like, okay, we have this cool algorithm. Now let's go find a problem to solve.
The first thing we actually built was, let's call it an AI factory. Like it took us 2 years to get the first FDA clearance, and that wasn't because it took us 2 years to build the algorithm. It took us like a year and a half to build the first algorithm, and then to like the engine, right? And then 6 months to develop and get FDA clearance. So it was always around, solving the platform problem. And then obviously we had to target real problems because people don't get excited about buying a platform, right? They really get excited about solving problems, right? But the
Yeah.
platform was our method by which we solve the problem in a way that is, consumable by the market.
Gotcha. We'll get back into your company in a second, but you went to RSNA. I've been going to RSNA almost every year. I don't know, 21 years or something like that. How was it? Was it good?
It was great. It was really good because I felt that, I felt there's like a sense of a bit less confusion in the market, a bit more consolidation. The weird thing is that people do want to like look at what's new in AI. I just think it's just because of the market
Sure.
is really mature. Um, we overuse the term, and honestly, to solve such different problems.
Well, and people are going to RSNA, the buyers, the users, so to speak, because they're just trying to improve their departments. They're trying to
Right.
improve their organizations, and they don't think about it in individual way. They think in a very holistic way. And so leaving that holistic mindset to go talk about a technology like you said, why isn't there a all right, we're going to separate just the software vendors. I mean, Siemens, you have to have all your stuff over here and then your modalities over here. We're going to separate the entire world. It like going to the Hams and here we're going to have a database companies and you're just going to start separating all out. That would be a horrible, you couldn't see everything, right? It would be very disconcerting and extraordinarily inefficient for the actual attendees.
Yeah, and I'll tell you that the thing is that if that's the mindset that the market is attuned to, like AI is this thing, and look, we see it, and I want to acknowledge that there is merit to it, but I see a lot of organizations creating like an AI strategy committee, right? And it's like on the one hand, I get it. I think there is value in like understanding disruptive technologies, but on the other, I feel it sometimes helps like we put in the same bucket very different things. So as I look at the AI space, I separate, you have ambience, right, which I would call it like documentation, and you have companies like DAX or a Bridge. Then you have the financial operational, like company like Cedar, or all the, RPA companies. And then you have like purely clinical, right? And in my mind, if you have like an AI strategy committee, my concern is like you're putting all of them in like literally the same bucket. Like those are very different stakeholders that have very different needs. And almost like, why would you even compare them and compare and contrast them? Like the commonalities are way less major than the differences, right?
Yeah, no, absolutely. So let's talk about, because I talk to some super sophisticated people and I talk to some very unsophisticated people who pretend they're sophisticated in the space when there's a lot of those. So what is AI? What should be put in the AI bucket and what gets put in there that frankly really isn't AI?
Well, it's a good question. And honestly, I tend to look at the simplistic market reaction interpretation. I think you and I joked about this a bit, but I really love the sentence. Knowledge is knowing that tomato is a fruit, but wisdom is not putting a tomato in a fruit salad.
Yeah,
So
that's a good one.
I think we want to be wise here and not just knowledgeable, because look, at the end of the day, in my mind, AI is the ability to generate an insight from unstructured data and then drive action based on it. Like that is what it means. And in my mind, any AI that is, complex enough or generates an insight that is from a piece of data that is unstructured enough and complex enough, I think it would categorize as an AI. And then in it, I would start breaking down the different like clinical AI, operational AI, financial AI. Those are
Yeah,
very, very, right? Yeah.
absolutely. So not just a bunch of if then statements. And the other thing too I see is people they get these purity tests. And so then you have like a chief of rad, you got head of informatics, you got CIO or whatever it is, and they may have maybe an incorrect notion about what AI is. I'm like, do you really want to argue and try to correct the buyer? Who cares?
Yeah.
Because at the end of the day, what does your solution do? Like we talked about before in prior chats. Like at the end of the day, they're just trying to say, how are you making me more money or cutting costs? Oh,
Right.
and by the way, is it? Let's be honest. Oh, it's gonna be better for the patient. Now you don't care about the patient. I mean, you kind of do, but you're trying to solve these things first, and if it goes down to the patient, awesome. But you see people. I've seen people actually argue with the buyer. Like, shut up. Don't argue with the buyer. Like, listen to what they're saying and meet them and go, okay, well,
Right.
they think it's machine learning. Machine learning isn't technically AI. Stop. Like, just
Yeah.
do you want to make the sale? Do you want to have a good relationship? Are you solving problems for them? Yes. Great. They're not joining your religion.
I mean, you have to meet the people. Like it's all about education, right? As I see
Yeah.
it, and in my mind, you have to meet whoever you're speaking with in their mindset. By the way, I don't think any side is right or wrong. I think it's about multiple mental frameworks we need to synthesize. Um, And yeah, I don't think it matters if it's machine learning or if it's AI or whatever it is. I mean, you have to, the one thing I will say, I want to maybe argue a bit, right, to make it fun.
Good.
I do think, so I was like you in the sense that people only paid lip service to quality and people only cared about cost of revenue. I am becoming a bit more balanced in my view. I've met enough people that are in the administrative suite that are actually making a decision. Like I was in a meeting with a hospital CEO, and I was like showing him the ROI and how much like revenue costs. Like I don't care about any of that. It flat out told me he made the buying decision, of a multi-million-dollar like piece of software based on quality. Like that's fine. To be clear, do I think the whole
Can we replicate this person across the industry? That's what I'm talking about. That is the right mindset. You have to stay in business. But I argue, I was on a podcast last week, and they were talking about, do you really ever think like the patient experience is going to matter and patient, et cetera? I said, of course it is. Like eventually the industry has to say everything revolves around the patient. Quality is going to have to improve. Efficiency is going to have to improve. Their overall experience is going to have to be improved. In my opinion, without AI, that is absolutely not remotely possible because of just the demographic and worker issue alone. There's no way, and it'll get way worse for them. But if you look at the rising generation, it's kind of this interesting thing is I almost see like, have you seen that? It's a meme out there not a meme, but it's a cartoon that shows the Earth, and it's like 65 million years ago or 70 million, there's like a dinosaurs, and it shows an asteroid coming down. Well, I say there's almost like two asteroids, and one of them is the demographic bomb that's coming, where you don't have the workers, you're not going to have the staff, you're not going to have the clinicians. It's just not going to be there because there's a supply demand big problem there. Then the other one is the rising generation of healthcare consumer that won't put up with anything like a Gen X that I did, or older millennials. Younger millennials and no way in the world they're going to put up with it. And so they got two asteroids coming down. That's the healthcare world here. It's like without AI, there is no way to divert those asteroids. I just and I've had so many arguments about this, and no one can actually beat me in that argument. So you're gonna have to show me how you deal with those two things without AI, because I can't even come close.
As you can imagine, I'm probably on your side of that argument. But I will say it's even in my mind, so I recently heard an interesting statistic that 2001 to 16, healthcare contributed to 9% of GDP growth, right? It's about 18%-ish today, but 29% of all new positions. 1, 2, healthcare, right? Apart from this being a shocking number of new positions, what does this tell you? It tells you that healthcare is one of the prestigious few verticals that have seen negative productivity growth. We're throwing people at the problem, and the more people we throw, the more inefficient they become, the more people we want to throw. And lo and behold, you talked about demographic. There are no more people. Like, that's it.
Yeah, that's a definition of a vicious cycle.
Oh, I think we're absolutely right. So you asked me, look, AI, not AI. In my mind, the tech revolution, which we've seen, by the way, in every other vertical, we've seen productivity growth coupled with technology. In my mind, we have to catch up in healthcare somehow. And I mean, that's the semi-advantage of us missing some of the SaaS revolution in healthcare. Maybe we can catch up 2 generations at once, like SaaS plus, maybe, I don't know, maybe I'm an optimist. But in my mind, that is the big opportunity we have right now. And you're absolutely right. I think we have no choice but to make people more productive. And one clarification on this, that's one of my things that I think that is counterintuitive about AI. People think about AI in the individual productivity lens. What I mean by that, I'm going to make my physician 10% more effective. I'm going to make my radiologist read 20% faster. And it can do that, to be clear, right? AI does that.
Yeah.
I am way more excited about the system-wide impact of AI, right? You improve quality, you reduce variability, so you eliminate waste, right? We know it from other industries, right? Agile, that is the whole point. The fact you can help, avoid a miss or prioritize a patient, yes, it may not make that in of itself does not make the radiologist, as an example, faster, but the downstream effects of that on the ED, on the length of stay, are much more profound than looking at the individual component alone.
That makes sense. Yeah, the platform strategy I think is superior. And it's interesting that I think you're the only company I've heard of that started there. Everyone claims to do that now or wants to do it, but you're the only one that actually from the beginning saw that issue, which is pretty prescient. So what makes ADOC different than everybody else? And
Well,
I know you're going to try to be super political about it. I may throw some fire into it, but anyway.
I'm gonna be political, but look, the one thing I'll say, we've always had the platform vision in mind, but
Yeah.
we didn't start as a platform. And actually, I think that makes a very big difference because we had to realize the complexities of building a platform. Like things that people don't realize, like they say a platform is basically like a DICOM router, right? When I talk about like imaging AI, that's kind of what people has in mind. And they're like, they're a platform. You know, these guys rate $2 million, they're a platform. We've spent, I kid you not, over $100 million on just the platform, right? And I'm like an AI company, right? And so I've spent
Yeah,
a
yeah.
bunch of money on AI, but like the platform itself, I have dozens of people doing monitoring on a daily basis. Every day, dozens of people doing monitoring. Like the platform is so immensely complex. So if you ask me what makes us different, I think that we really have a much more sophisticated platform that enables true scalable integration. It's not just, a bunch of apps that you can like, it's not a contracting vehicle, which is what AI platforms today are. It is actually deeply integrated platform. And I think that is what gives a lot of credence. So when a health system contracts with us, they want to have another AI, it's basically a flip of a switch. So no need for AI, the workflow is fully integrated, like we take care of the monitoring, the orchestration. It really is like a seamless experience for the health system, which I think is what actually, in my mind, necessary to solve the platform problem.
That's cool. So are there any kind of edge cases with you right now where you have some customers, or maybe it's just one customer doing something that's just like really unique, something you didn't anticipate them doing with your platform?
There's so much. I mean, I'll give two very cool examples. One, I'll highlight University of Miami recently, and they've created a concept called point of care AI.
Hmm.
And what I love about it, it's basically using the same technology, but having a different frame in mind. So their problem was that they had incidental cases, acute cases in their outpatient imaging. Right. So a patient comes in, maybe lung cancer screening, they may have something acute nobody's expecting. Let's say pulmonary embolism, right? And because of the increasing backloads and the labor shortage, that patient may be waiting for days in the list, right? So nobody misses them. They're just like stuck there under like a batch of 200 cases nobody came to. So what they did, they said, okay, you have your AI that can triage stuff. What if we change the whole patient experience? Every person coming in the health institution, we're going to run the AI, and the AI is going to do a green flag, red flag. If the AI is green flag, then everything's fine. We do our standard of care workflow, patient goes home, nothing happens. If AI is red flag, okay, they keep the patient in the facility. They're alerting the radiologist right away. The radiologist reads the exam and gives a report on the spot. What happens there? If indeed a patient has something acute, they will take them by the hand to the ED from the outpatient. So think about that experience. Like you're coming in, you may have something acute. You can go home and unfortunately something really bad could happen. Or you go in, you get this, and they can like escort you by the hand to the ED. That is such a great like use case that is so patient facing, which is what I really like. I think sometimes AI is a bit hidden. So that is one really cool example. I'll pause here.
Nice. That's
Um,
super cool. You mentioned a second
So
case.
second, I wanna, maybe can highlight Yale and Mount Sinai. I think they've been it's now it's a bigger product line for us, but we've started to go on the route for a big problem there is in health system is coordination of care. Patients fall between the cracks all the time. One of the
Yeah.
things that and that relates, by the way, to the labor issues we have, because the complexity of healthcare keeps increasing and increasing and increasing, and it's just very difficult to really maintain the workflow we want. A great example of that is something called PERT, pulmonary embolism response team. Those that haven't heard at home is basically, think about it like a new high-risk workflow for PE, kind of like stroke. Basically, they're now doing pulmonary embolism where they can do an intervention. But the problem is, to do that, you need to have a specialty team that is the PERT team, and they need to evaluate the patient. So now the big question is, okay, we just need somebody call the team on this patient. Sounds simple, right? The problem is, it is very difficult to do change management in a health system. And even great places with great PERT teams, they trained everybody, even critical care, radiology, everybody trained, did not have the adherence to the protocol. It was that bad that UH Cleveland, one of the best health systems in the state, right? They had a great PERT team, and they found out, their research, unrelated to Aidoc, 75% of PERT eligible patients, basically high-risk PE patients, did not reach the PERT team. 75% for a trained PERT team, right?
That's serious.
And look, that is the problem. It's not about the PE. It's about change management and the fact we're creating more silos with the more people. So in this example, it started in Yale and Mount Sinai. Basically, they said, well, what if we don't alert just a radiologist for a high risk PE? Let's alert me, and maybe give me more information. Give me like the EHR. Give me like more information from the image. And based on that, I can actually risk stratify the patient. And now we flip the script. We don't need the ED to alert them, right? They now get like alerts. They can actually be proactive with the information. And again, both of them have seen like amazing value. So those are the types of things we couldn't expect when we started this, but really the value is connecting the dots across the enterprise, across service line, not just being a one physician tool, but a system-wide tool.
Yeah, which is where it needs to go for sure. So you guys have had, I would say, greater than average success compared to other AI companies. So I was watching a podcast. One of my favorite I watch every week is called the All In Podcast. It's people either love it or they hate it. I find it challenges some of my thinking, and I laugh because they make fun of each other the whole time, which is kind of interesting. They're always trashing each other. But one of them, David Freeberg, who he said an interesting thing. There was something going on with the government passing some regulation or something like that, and he was talking about, he kind of went around. He's a pretty nice guy, so when he gets upset, I tend to listen. And one of the quotes he said was, every startup that's ever existed is a disaster until the very moment when it isn't. So it's just scratch and claw, and you never know if you're going to make it, or are we doing the right thing? You're just all these, and then all of a sudden, pop, the sun comes out. You're like, what? Like, so every startup's in there. Which side are you on that? Are you still in the whole, oh my gosh, what's going to go on? We're doing great things, but we're going to make it. Or are you now on the other side, like, we're no longer in this utter chaos disaster where we can breathe a little easy right now?
Yes, that's a really good question. I'll say it this way. I don't think we're definitely not in the disaster category, but I do think we're still in the utter chaos because the space is so evolving. I think the question isn't, is Aidoc going to be, is going to live? Maybe. I mean, there's always a risk. But in my mind, the big question is, can we build like a 20 billion, $50 billion business? That is the real question. And that is, I would say, that's my bet. Are we going to be the clinical AI platform for a health system, right? I mean, whatever that means. So that, I think, is the utter chaos. But that's a lot of our thinking, and the bets we take in the market are related to that. And we're willing to swing big because that's what we're aiming for, is really to transform our health system operates. Honestly, like, I want health systems, and obviously I'll say it with humility, and it's going to be a long journey, and we're going to do it with the partnerships. But ideally, health system a few years from now will say, hey, we're running on Aidoc, right? Like, that's our intelligence layer. And I'm really excited to work towards that vision. It's going to take a lot of work by a lot of really smart people. So to your question, again, I don't think there is like a risk of like us imploding. Probably we raise a bunch of money, we're stable, we're making, our revenues are growing well. But I think the question is how big can this get? And I think that's what we're all, but honestly, that's why we're all here.
That's good. So how much of some of your competitors' ineptitude helps you versus hurts you? And the only reason I ask that question is in my conversations and in data that I've collected from people from healthcare is there seems to be almost so they're eating filet mignon, AI's filet mignon, but it's the same flavor every time. And part of it is sometimes a company will say, here's filet mignon, and they walk in with a Twinkie. And so you get kind of colored by the same brush. These other AI companies' failure there's been some pretty spectacular flameouts, right? Where they promised the sun, moon, and the stars, which, my opinion, like, what were the VCs doing? Like, why in the world? You had to know from the beginning that the emperor had no clothes. But then also the buyer side, like, what's kind of your responsibility? Like, why didn't you do better due diligence on them? So I see that kind of making it harder to make some sales because some other companies have salted the earth, blown up the bridge behind them for everybody else. But then the other time, I think because you're obviously operating at a much higher level, that people could hopefully see, no, these dudes are really different.
Well, first of all, thank you. And honestly, you're right. I think that part of the challenge is the hype and hyperbole we have in the space. And it's so weird because on the one hand, I feel that we have so much hype, and on the other, I do feel this is the most transformative piece of technology that healthcare has seen. So it's kind of weird because I feel like both are actually true at the same time. And look, is there a dystopian future where people are going to be implementing a lot of AI wrongly and then it's going to implode? Like, absolutely. I think that is a very, very, very real risk. And why I am sometimes extremely, concerned about, some of what I'm seeing in the market where people are making kind of obviously not everybody, I don't want to make bold statements, but sometimes like make uneducated decisions that not going to work well, or like lead them to a wall and get physician frustration. And it's enough to see one or two failures and people lose hope. And we've seen it, right? We had an AI winter. I know people right now are like, oh, AI is all the rage. But I mean, we're like a few failures away from this like blowing up in our faces. And therefore, in my mind, the only path forward right now is like an actual education. I mean, that's the one thing I will say, and say to everybody who listens, I've been invited multiple times this past month to speak with health system executive suites to just educate them about the market, not about Aidoc even, right? Just like what's going on, what to look for. In my mind, like if people are educated, we win. Not because, not just because I think we have the best offering, because I think people would have the right path forward in their thinking. And you're absolutely right. It can massively backfire. And I think the only way is like true education, really smart people digging in, understanding what's real, what's hype. And I know how difficult it is. Like the one thing that people don't realize sometimes, like me as a platform, I also vet companies that onboard on my platform. So I see like if I'm having a hard time, right, deciding what's real and what's not, like I'm sure the market is like 10 times right. I mean, even for us, it's very difficult. So I get it. I like truly, truly get it. But honestly, that's the only path forward.
Yeah, that makes a ton of sense. I like your thing about education. It's kind of what I do at my company at Reaction too, is I'm in conversations with companies where we're trying to help them get much better insights from their customers, much better insights from their patients, et cetera. But the way that they approach research historically is so academic, university based. And it's like that doesn't map over. Like your customers don't have to engage and give research to you. Your patients don't have to. You may want them to. They certainly don't have to. So I spend a lot of time, and we spend a lot of time just educating. We'll say, hey, we think our platform's the best. We think we have the best experience management platform, but whether you use us or not, at least start to bring these principles in. Like these principles shouldn't change at all in how you do it. So whether you use us or somebody else, make sure that you stick to this. So that education is essential, because if they're not kind of on board with the best way to do it, they could end up being a pretty bad customer. It could be a relationship where it's, you almost wish 2 years later, like, oh, geez, did we cancel the contract? Like they're more trouble than they're worth. So it's that education, I think, just critical. Do you? You've probably seen some of my posts. I kind of make fun of outside companies coming into healthcare. I like to kind of take pot shots at. I call it the healthcare hokey pokey. I won't say their names, but there's some. Everybody knows them. They're in healthcare for a year or two, and then they're out, and they're in and they're out. Left foot in, right foot in. Whatever it is. But is there anything at all that healthcare, because they're behind the curve, can learn from other industries when it comes to AI adoption or utilization? Utilization is probably better. Like everyone's adopting AI, but are they really integrating into their organization? And I don't know if there is much that can be learned from other industries. You might have a different perspective on that.
No, it's a good question. Look, I will say the interesting framework. So I don't know, right? I haven't sold in a lot of these other industries, right? So it's hard to see.
Yeah.
But the thing I'll say is that I think healthcare has a tendency on like being late adopter for even, building an enterprise bus. Like even like the IT architecture, sometimes, right, we're kind of a bit cloud, honestly, even just the cloud, right? I think, we're behind there. So I think honestly, just finding and learning from other industries and like doing accelerated adoption cycles, even for this other stuff, because like if you have cloud and like easy SaaS and easy contracting, like that accelerates AI. Because right now I will say, me for a company, even like the way our contract is built is sometimes hard for health systems to go through. Right?
Yeah.
I mean, I'm still having like the capex versus opex conversation sometimes, right? I mean, it is sometimes that is comes back to my point about like maybe doing two revolutions at once. We'll finish the SaaS revolution and then adopt AI at the same time. So yes, I think there are obviously lessons learned. And ideally we can like jump the adoption curve.
Absolutely. So does health systems moving their Epic instances and their Cerner instances and a bunch of other stuff to the cloud help you guys or hurt it? Or is it a null?
I would say no, definitely helps us, right? Because look, AI requires a lot of scalability. So now I'll do a controversial statement maybe of my own, but I mean, I don't believe in on-prem AI. I just don't like. I see the level of governance that is needed and also the scalability. We had a health system that grew from like 1 to 20 AI, and like all of their imaging volumes like go through AI. I'm like, yes, you're gonna do it on-prem. I mean, honestly, even
So
if you
if they're doing it on-prem, what do they do? Like pure storage
no,
blades or like
like
what are they
some
doing?
do the compute. The
Jeez.
actual compute. I mean, and then they want to like get to like new. I mean, I mean, obviously, it's not. Again, we never did it on prem, but the only way I did it, the only way I'm
Yeah.
saying, like, you asked me if cloud helps us, like definitely, because cloud is really necessary. So the more the more health systems go to the cloud, we're obviously in
So
favor of that.
do you have a cloud preference? I mean, AWS, Google, Oracle, Microsoft, like what
Well,
do you
we use
care?
AWS. We're very happy with them.
So are we, by the way. We're built on AWS.
But I'm sure other health systems have, their own preferred partners. Yeah.
Okay. Um, I'm going to jump totally out of this just because it was funny. I'm on X a lot. It's where I get a lot of my news. People and not conspiracy theories, just news. It aggregates it.
Yeah.
Saw this guy rolling in a Cybertruck, a Tesla Cybertruck, and he had the new Apple VR on, and it was right down here in Silicon Slopes, right down the canyon from where I am. And I just started thinking about like, I was going to put this on as a LinkedIn. I'm probably going to put a LinkedIn post. I want to make fun of it, but so I'm going to scoop myself about I could just see radiologists rolling up in their leathers in their Harley, and they got the VR on, and they're trying to do reads while they're driving. You know what I mean?
I
Like,
mean, I have
so what do
no
you
doubt.
think about the whole Apple? What do you think about the whole Apple mixed reality headset thing? Like, I think it's a cool concept, man. But if someone tries to walk up to me in the street with one of those things on, I'm just gonna tear it off their head. Like that is some, I don't know.
Yeah,
I'm not a fan right now.
I
But
agree. So I will say I don't think of like the current iteration is like gonna make the big difference, but honestly, I think it's gonna be there. I mean, I'm actually like I've
it's kind of
seen
inevitable, isn't it?
it's inevitable and actually not not that far off. I mean, look, you so probably we talk about it like people spoke about mobile phones a while back. So, but I think like it's just so convenient. You can do it like while you're doing other stuff and like not thinking, blinking and like just looking a direction. I think we'll just see a lot of it. Think about kids with their Instas, right? I mean, or whatever they're using today. So, and now imagine
Oh
they don't
man,
even have to
dude,
click. They don't even like, right?
if you think it, imagine like it's bad enough like kids having smartphones and they're on TikTok and everything else before they're 14 or 16, and talk about the
Oh
developmental
yeah.
issues, especially the social issues. Imagine it's there and it's like that's what I want. Like it's going to get to the point you're going to have glasses, like it's just going to be sunglasses or normal glasses, right? They won't know. But my whole thing is
Won't
I
even
need to be
have
able to
to
tell if
taco.
yours is on. Like if we're on right now, there needs to be some sort of external thing that shows me whether you're recording or anything. Like, that's my whole thing is like, are we, because you're looking at me, it looks like your eyes are, are you actually paying attention? Like
Yes.
what's happening? So that's my only concern about mixed reality stuff, even when it gets to just glasses where you can't even tell. Like I put my blue light glasses on and no, it's the full, I got the whole display and it's doing everything. Is just I agree it's inevitable, but it's almost like I'm kind of lamenting. I'm the old man, the Abraham Simpson yelling at a cloud, just on my porch, getting upset. But it's
And by the way, same for AI, right? I mean, when do you know when an email is going to be written by a person versus AI? I mean, soon enough, not a radiology report. I mean, I think soon enough we'll see the similarities blend. But look, I mean, or not knowing when we're getting the human interaction versus the machine interaction, like when we have their attention and when they're focused. And I do think it is going to be a big cultural change. But look, if we're going to the health system world, I think some of these changes are going to be truly necessary, right? I mean, I think we're in the.
mm-hmm.
By the way, I want to add, you mentioned the two big comments. I want to add a third. In my mind, this is more the competition health systems are facing from, the other, who's like the biggest physician employer in the United States?
It's Optum now,
It is
right?
Optum, right?
Yeah.
And bet your ass their incentive is not to get people to more health systems, right? So I think we'll see that is in my mind like the third comment is like, how do you even, and then if so, how do you navigate patients into even health systems, right? I think the patient acquisition is going to be a strategic risk moving forward.
Yeah, I totally agree. That's why I find it so fascinating. Like Amazon has their own clinics for their employees, and then it's gonna. I'm assuming, if I had to guess, they're eventually going to be putting clinics to Whole Foods customers, like kind of the Walmart approach. It just makes too much sense, especially as now there's more reimbursement that might be coming to use food as medicine. So it's not everyone having to take so many meds and injections. It's more of how about we kind of deal with that up front, right? So it makes sense. And then you have General Catalyst going with Mark Harrison's Hatco company, and then they're buying Suma. It's like there's so much broken dysfunction in healthcare, and so it's like you see these new models kind of emerging that hasn't quite been done before, although it's a little bit like the coal mine factory town that used to exist in the Appalachians, where there'd be a big coal mine and the whole and the company that owned the coal mine would have the the hotel and the store, and we give the insurance. It would like do everything. So you're seeing some of that. It's certainly what Optum is doing, and there's no way everyone's going to stand by and let, I think UHG do it. But it's interesting because it's kind of back to the point I was making before. Was there anything we can learn, or other companies can learn from what's happening in other industries? And that's kind of a mistake that a lot of these outside companies have made in healthcare. Like the beachfront of healthcare is littered with the shipwrecks of people who didn't understand the space. They see the dysfunction of healthcare and they think it's a bug. And I'm like, no, it's a core feature. Like, unless you can change the municipal laws, the county laws, Department of Health laws, the state laws, and the federal laws, you can't innovate those out. So it's those already exist. So given that those exist, can't do it, what can you do within the dysfunction, the friction that already exists? So that's why someone like you coming from within healthcare gets it. And those companies coming from the outside of healthcare and say, here's all this inefficiency and we can do to this industry what we've done. Yeah, and it's like, no, you don't get it in those other industries. Those really were bugs. Here, that's a feature. You're not going to change that.
I mean, this is why I don't love the term disruption for healthcare, right? I mean, you don't disrupt, medical care, right? Like you can transform, you can evolve, totally.
Yeah.
And in my mind, so I totally agree with you that one of the biggest problems we have in healthcare is the fragmentation of incentives. Yeah. Have the fragmentation of point solutions for AI, but honestly, all of healthcare is like a bunch of point solutions, aggregated together. The payer doesn't have an incentive, the same as the health system. So in my mind, one of the counterintuitive things we've learned is that you have to elevate the conversation a bit at least. So a big trend for us was going from the physician to the health system as an example. Why? Because now you can at least connect the value dots on a care pathway. I'll give you one of the things that really hit me. There was something called NTAP, which is stroke AI reimbursement, temporary reimbursement. And it was about $1,000. So $1,000 to run an AI that calculates, and I'm simplifying, so but bear with me. So
sure, of course,
the lessons there. But so $1,000 per patient to analyze and find suspected stroke and alert somebody in the system. Do you know how much a radiologist gets to read and diagnose and finalize the report on the same exam? Maybe $150. You would ask yourself, why the hell is an AI?
Where's the 850 going?
Well, yes. Well, why isn't an AI that like barely does one thing out of the full report gets like 7 times? Well, now let me flip the question as it relates to incentives. What is a stroke DRG? So how much a hospital gets for a stroke patient? Let's say around $30,000, $40,000, right? Depends. Would you pay 3% extra to get an expedited care pathway? Oh my God, 3%? That's a bargain, right? That, I think, was the key for us understanding the fragmentation of value. If you're just looking at the physician fee, fine. But that's not what you're optimizing. You're optimizing the whole thing. And that is why I really believe AI decision has to be taken at an enterprise level. If you just look at it from a service line perspective, you might lose the big picture, right?
No, that's a great way to put it. That's really good. Do you see any, I know we got to wrap up here, but this has been awesome. Maybe a couple more questions. Do you see any commonalities out there as you're making sales of organizations that are ready? Like, how do you ascertain this is a tire kicker, they're not ready? Because you can waste, I tell people all the time, so I'm on some boards, I do some advising here and there, where I always tell them, just say, I know it's trite, but you're going to make a lot more money disqualifying than try to qualify. Like, try to get to a quick no as fast as humanly possible. Like, how do you find that out? So it's from what you see, what commonality exists among those that are actually really ready to work with you versus those that are they're just not, and nothing wrong with it. It's just every organization's in a different phase and has a different culture.
I'll tell you what for me is like the biggest thing, and it's one of the things that was so bizarre to me when I entered this, because it's very common even today. We go to a health system and everybody we speak with is excited, right? You speak with radiologists excited, cardiologists excited, neuroscience excited, right? IT excited, everybody excited. Nothing gets done. I'm like, how is this a thing? In my mind, the biggest issue we have right now is that the health system is not clear on who is making the decision. In my mind, the biggest
Yeah.
thing that changes the maturity is, are they clear on who? They don't even have to have a clear decision-making process, but who is making the decision and based on what? If that sole point, which is semi-political, is resolved, everything else can come into place, because then you can talk about ROI, what are the use case, what's the plan, okay, fine, because then you have like a stakeholder. But what happens so often is, again, you have these myriad of people. So that I think is like the biggest differentiator, I would say. Radiologists, by the way, I will say I see them more and more being the leaders in like the AI decision making, which is something I am extremely excited about as a profession.
Well, that makes sense. I mean, I've seen, since I've been in healthcare since 2003, radiology is almost invariably where the earliest adoption of almost any tech occurs,
Yeah.
just because they're so business minded. Where, I mean, I'm sure, I know there's other areas where it happens, but on average, radiology seems to be more willing to experiment with new tech than any other part of a hospital.
And I think this was different even then, when we started a few years ago. I think the radiology, with the AI revolution, I think radiology took it upon themselves to really learn and be like the most educated people in the room, and it's actually paying off. And I see like them leading the AI company. Not, again, highly varies, depends personas, but I mean, oftentimes I see them more and more like leaders in the AI strategy. So I'm actually very excited about that. Some really great systems.
That's awesome. So last question is, unless you have any questions for me, which you definitely don't need to, but is there any question I should have asked that I didn't ask? Anything that we should have discussed that we failed to?
No, look, I think the real question is maybe that, I sometimes when I talk with people, then they're just like, they already had a lot of doubts about AI. And after hearing this conversation, I might also be like, well, okay, so I have all this noise, like, what do I do then? Right? I mean, okay, you say education, like, how do we act? So maybe that I think kind of is maybe an interesting question. By the way, I don't know, maybe
Okay.
a question to you as well, right? So how do you think, like, if you're giving advice to a friend who's CXO of a health system, what do you tell them to do?
Well, I give such bad advice to hospitals just from that, because I'm like, you need to move faster, and
Right.
they're just not ready for it. This is going to sound weird. I'd say honestly, stop reading research reports. Like I would say, just have some conversations. Like, you have other peers out there. Talk to them. Send a quick email out. Send them a message through LinkedIn, whatever it is, and ask them questions. I see so much generic information in the reports where it's an apple to an orange to a potato to a Miata. I mean, that's kind of the that's
No,
kind of
that
my general suggestions on things. There's too much herd following rather than actually being a true innovator, a true leader. There's a lot of following that goes on, which can be good in some cases, but a lot
right.
of times people kind of turn off their decision making, their higher function. I like the way you kind of termed yourselves, that you want to become the intelligence layer, and there definitely needs to be more intelligence layer within health systems, even not just from an architectural perspective or an information technology perspective, but from a cultural perspective. I don't, and maybe I'm insulting most systems, but I think there needs to be a cultural intelligence layer installed.
No, I don't think, again, I will say, even within ADOC, putting health system aside, I think having a culture of, look, intelligence in my mind is basically very effective change management. And I think thoughtful and effective change management, right? That's effectively what it means. So I agree. And look, I will say, first of all, I love your point, and you have background in class. Can I say that? So, I mean,
Yeah.
about research reports versus, and I totally agree with you. People that are spouting, BS, and so-called experts, right? And to be clear, I have nothing bad to say about class. I'm saying generally some people,
Yeah. Yeah. Yeah.
and you have to be, and I think talking with people and seeing what's in the market is real. I will say really like the education piece is key, and question to ask yourself for like data drift and how do you mitigate drift. Um, Orchestration of data normalization. That's one of the areas that is like most counterintuitive. People like don't know that is even an issue. Measuring value, I think that's a really another key point. Like, and honestly, in my mind, these days choosing an AI product is way less on the product, more in my mind, more so on the partner, because it's such a journey. So it's not like buying, you're buying a thing and then okay, 5 years from now it's going to be the same because the market matured. Like whatever solution you're buying 5 years from now is going to be so different and so much more evolved.
Oh
So just
yeah.
pick, a partner, not like a product, I guess.
Yeah. 100%. And I've kind of riffed on this before, but it's organizations are looking for at the core, even if they don't articulate it, and that's what most people do not understand, is they're looking for the partner. People know, like a CIO knows, hey, as long as the system is stable and they're on a semi-modern architecture and it integrates and there's the privacy, just checks the basic boxes, like basic foundation. They know that at any time, some other company is going to leapfrog their current vendor in tech. But then they'll leapfrog. It's Epic doesn't win because they have superior technology to all the competitors. They never have.
Yeah.
They win because they have engendered trust. Like if something goes down, we'll send an army of people. We won't blame it for you. And hey, if we say we're going to go live, it's going to go live because we're going to make you do the right things. So you can trust us. So they're like, hey, yeah, Athena is going to be better in this, but overall, we can trust Epic. Oh, Cerner could be better than this. That's what people don't understand is Epic innovated the relationship layer, and they didn't obsess so much about the architectural layer. I mean, didn't mean they were slouches at it.
Good point.
They understood that. So to your point, it's someone else could have better algorithms. Someone could come along with a better platform there sometime, but given what you're doing, it's like they trust us because they know we're always going to catch up and pass. Someone may lead, but we're going to be that ship that they're always going to feel comfortable with, that we're here, we are innovating, we are delivering more forward. But the difference is they can trust us. And that trust is, trust as a service, trust as a architectural layer. Geez, that's what most companies don't get. And the ones that get that end up being more successful, but it's so hard to do because it means all the executives need to be trustworthy and they hire trustworthy people, and we don't lie and we don't oversell all over the place. That is almost impossible for so many companies to do.
Wow, that's really great observation. Totally agree.
Anyway, this has been fun, man. This was really fun.
Yes. Yes.
So
I think
everyone go to, if you want to learn more, go to aidoc.com. Check them out. They've got a good LinkedIn. I don't know if are you on X or anything?
I am, but it's less prominent. Yeah.
Yeah, no worries. Cool. This is great. We'll have to do it again sometime, maybe after HIMSS or something.
Absolutely.
Awesome.
Well, thank you, Jeremy.
Yeah, take care. See you guys.